inhale, exhale, and like the flare. It's an exercise.
Yeah, and your body gets weak when you don't move it.
Yeah.
And so one of the things that may be helpful, it's safe to do pulmonary rehabilitation. We were talking about that before.
Yeah.
That's a monitored exercise program for people with COPD to help them to become more active. And when you're more active, you actually have less shortness of breath. The stronger your heart and your muscles are, you can do more activity with less breathlessness. We were trying to get you into that program at St. Francis, but then the EKG was a little bit abnormal. Hattie had to get the cardiology consult, and so we need you to get that echo, okay? But it's still safe to do a pulmonary rehab program as long as the echo looks okay, even after you've been hospitalized. They actually encourage it. So I think that's one thing that we can help you do, and what I hope that they can do is help you build your confidence again. And if you start to feel short of breath, the staff there can help you manage it right away. Now, I'm going to let you know that they're going to recommend that you do pursed lip breathing, Mr. Makapagal, because that is a very important tool to help manage your shortness of breath. That doesn't involve medications. Doesn't mean you can't still use the albuterol, but it can really help a lot.
Yeah.
Okay, so before then, I want you to practice it as much as you can.
The hospital gave me some I don't know what kind of it helps me a lot also. That
The incentive spirometer?
Yeah.
You try to make the ball go up?
Yeah.
Okay, yeah, so that's good for lung exercise, but we still want you to move the rest of your body. So,
Maybe that's one thing I like to do. Movement.
yeah, so it can also help with your mood, etc. So even if you have to stay in the home, your wife is doing some exercises. I don't know if you can do, right, I don't know if you're still having knee problems. Are you still having knee problems right now?
No.
Okay, so even if you're sitting at home, you can still strengthen your leg muscle by doing what your wife's doing.
Because it's the knee surgery, it's getting stiff.
It's getting stiff, right? But
Yeah, it's getting stiff.
It's still a good exercise to strengthen your quadricep muscles. You don't have a lot of muscle in your legs. Okay? Those are things you can do. You can sit and you can start doing and strengthening the muscles in your arms.
I have some balls also.
Somewhat?
The stress ball?
Stress ball.
Stress. Okay, good. You can do that. But one of the things that we have to do is to help you manage your shortness of breath. So that can come through medications, and you can use more of the albuterol inhaler if your wife's not home to help you set up the nebulizer machine. You want to make sure you use the albuterol before you start doing any activity. So if it's a good day and your daughter's here and she wants to take you for maybe a little walk or something, make sure you take the albuterol before you go for your walk. Okay, that will open up your airways, make you feel more comfortable when you're walking, and maybe help prevent a flare-up from happening. If you start to feel short of breath, stop what you're doing right away. Don't overexert yourself. If you push yourself too hard, you're going to be in trouble. You're going to feel really out of breath and feel like you're flaring up. So if you start to feel a little short of breath, just go ahead and stop. When the shortness of breath goes away, go ahead and restart. It's okay to take lots of breaks. Okay?
How long is the ideal time for exercise a day? 10 minutes?
You know what? At this point, I would just do things as tolerated. That would be my recommendation, because you haven't really been active. I think for as long as I've known you, you haven't done that much. Since you just got out of the hospital a couple weeks ago, I mean, I would say just doing that for like...
that's already exercise.
Yeah, going the...
So it's not really requiring you to really walk one block?
No.
Maybe in the house you can just go and walk around?
Oh, absolutely. Yeah, any physical activity is good.
Because he is just lying down all day.
Yeah, it's just like...
You can't be lying down all day.
Yeah, I don't.
Are you really lying down all day?
Yeah, he will just go to the table to eat, and I will be the one to bring the food, heat the food, and go to the toilet if he needs to, and then he'll lie down.
Go down to the bed and then lie down all day.
Oh, Mr. Makabagal, are you depressed?
Maybe sometimes.
Yeah. So, because because, were you doing that before you were in the hospital? Were you laying down, were you in bed all day?
Yeah, I did it before because that's the doctor asked me when I rushed into the hospital, and the doctor said, how is he walking? And that's the problem. So he doesn't want to go out. He doesn't want to move.
But you've been lying in bed all day?
In the
Yes.
hospital?
No, before you were in the hospital.
The
No, you lie down most of the time.
most of the time.
Oh, Mr. Makaba, that's not good for our bodies are not designed to be
Yeah.
laying down all
Yeah,
day.
yeah.
Okay, they're designed to be moving. Okay, and I think that's one of the main reasons why. Now, again, you do have severe disease. Okay, and I know the doctors were talking to you about advanced care planning and thinking about the future and what should happen if you can't make decisions about your health care. And I think that's important.
Yeah.
But I think to help, and it's hard for us to say actually how much longer you'll have to live. Some patients can live longer. It's really hard for us to prognosticate, but if you want to try to improve the quality of your life right now, that's something that you have to do, is to be active. So if your father has been laying in bed most of the time, our expectation for like the next couple of weeks, like short term, would just be for you to be sitting up.
Yeah.
To be sitting up most of the time, and that's actually very important for your lungs too, to keep them open. When people are in bed in the hospital, that's probably why they gave you the incentive spirometer. You're not expanding your lungs the way you should be, and you're at risk for having lots of lung problems. Okay, so you need to be out of bed at least as a start. When sitting up, just moving your legs like that would be a really good start, and moving your arms. I would just say like a minute, 3 or 4 times a day, breaking it up, because he's not used to doing that type of activity. We're starting pretty basic, and getting up and just walking in the
Yeah.
house would be fine. Okay.
Yeah, walking in the living room.
Yeah,
He doesn't
It's
want,
not very demanding. You just have to walk in the living room.
and then
just
just
walking-
stop. When
you're not even going outside.
Stop.
Or
And
walking in place. If you're watching TV, you enjoy something,
Yeah.
just walking in place.
So
for like
instead of
30
just lying
seconds.
down, while watching.
I think that's why I rushed into the hospital, because I started working, and then I'm even though I can go to the bank, I said, okay, can you go to the bank and just bring this to the bank because
Yeah.
I have some check. And then when I get home, oh tomorrow, but I need to find something. So okay, I'll do it. Then I told him I'm not here all day, so you have to do it. So I'm sending him an errand just to go out and walk.
Do you are you able to care for yourself at home? So if
Yeah.
there's- you can walk, get up, go to the bathroom, you
Yeah.
can take a shower, you can get dressed. Okay.
Probably I will not prepare your meal so that you will be forced to prepare your meal. Because
Especially,
I'm bringing even the food on the table. You will just sit down and eat, and then after that you. So
Yeah, I mean, I think that, and I didn't realize how much inactivity you have. How severe that was for you. And so, I would balance it out. So maybe not
dishwashing, no.
right. And so just gradually have you start doing more of the things, because if you don't do those things, you're never going to be able to do them.
Yeah.
That's how our
Yeah,
bodies
maybe,
work.
yeah.
Our
I-
bodies
Maybe
will
that's
be-
why
And
they
cooking,
rush.
I will not. We will not require the cook, but at least prepare your meal. You take your meal so that you will walk.
Okay. Mr. Makapakal, have you had any fevers, chills, night
No.
sweats, swelling in the feet or the ankles? Okay.
I noticed that I have some. Nowadays, I cough.
You are having more cough?
Yeah.
Okay. When did that begin? Or was that since the
This week
hospital?
only.
Oh, this week only? And are you coughing up more mucus?
Sometimes.
Okay. And are you having any other bothersome symptoms, like a sore throat, a stuffy nose, or any cold-like symptoms?
My running nose is. I'm used to it.
Okay. And I'm sorry, are you coughing up a lot of mucus or just sometimes?
Sometimes.
Okay. And what does the mucus look like to you?
Sometimes white, sometimes yellow, sometimes
Okay.
very thick.
Okay. And are you having more shortness of breath in the past week?
No, no.
No? The shortness of breath is the same?
The same.
Okay. Has the cough gotten worse in the past week or is it about the same?
The same thing.
Okay. Are you having any heartburn at all?
Sometimes heartburn, yeah.
Okay. Is that what triggers the cough?
I really do not know.
Okay. Is the cough severe? Like, does it wake you up from your sleep at night or is it pretty mild?
No, no. It is very mild.
Very mild?
Yeah.
Okay.
I just want to speed up my nerves sometimes.
Okay. And you feeling that's coming from the lungs? Or from the back of the throat or the back of your nose?
Here.
From the back of your throat?
I'm relieved already when that mucus gets out of my mouth.
Okay. Have you had a lot of sneezing or runny nose?
Running nose is, I'm used to it.
Okay. But worse in the past week?
Maybe this is year-round already.
Oh, so you have it year round, it's just a little bit worse
Yeah.
in the past week?
Maybe allergic. I
Yeah.
really do not know.
Okay. Well, if you have a lot of like sneezing, runny nose, or itchy watery eyes, you could have a cough more from
My
allergies.
eyes is very. This one is very itchy.
Okay, okay. Are you taking your Symbicort?
That's why I will. Can I ask you some refill? I memorize the products the medications that I need to be refilled.
Okay. Are you taking it now? The
Yeah.
Symbicort? Okay. Do you get a 90-day supply or 30-day supply?
I still have one refill at home,
Okay.
but I don't want to be out of it.
Okay. Okay.
Symbicort, Spiriva,
Spiriva you're still taking every day?
Amlodipine,
Okay.
Venacepril 10, Tenacepril 20. That's all.
Okay. Okay, so why don't we do this? Why don't we have you have a seat right here? Okay, and let me do a physical exam on you. Now, are you using the home oxygen?
Yes, sometimes, not too often.
Not too often? Okay. Maybe what we need to do is to see if you really need it. I think when you were in the hospital, the doctors gave it to you because your oxygen level dropped when you walked.
Yeah.
So we'll have to walk with you in the clinic now and see what it is, to see if you still need it or not. Okay?
The nurse helped me to walk,
They helped you to walk.
and my oxygen level drops. And the nurse told me, let's go back.